You hold a small flower in your hand and wonder what it will do to you. Your heart moves a little faster. Your mind says, "Be careful." That is wise. Cannabis can help, but the way you start matters. The dose, the timing, the space between each use. Tiny steps keep you safe. Tiny steps also help you learn what your body needs.
Picture a tiny oven that warms the plant, not a flame that burns it. This is a dry herb vaporizer. It heats the flower to a steady temperature, so the active oils lift as a warm mist you breathe in. No smoke, fewer harsh byproducts. The effect comes fast, then fades over a few hours. This lets you test very small doses and see what happens. It is a simple way to start gentle and smart. Here is the first rule. Start low, go slow. Begin in the evening. Use 0.025 grams of ground flour in your vaporizer. That is a small pinch, about the size of a tiny pea. If your flower has 20% THC, that pinch holds around 5 milligrams of THC before any loss. Breathe in as if sipping warm tea. Take a small inhale, hold 1 second, breathe out. Wait a few minutes and notice your body. Keep the rest of life quiet and calm during these tests. Why evening? Because you can sit, rest, and watch for effects without needing to drive, work, or do hard focus. In most people who inhale cannabis, the effects start within minutes, peak by about half an hour, and wear off over 2 to 4 hours. That fast rise helps you learn your dose. It also means we want space between doses at first. A 4-hour gap gives your brain time to settle before the next test. Now the ladder you climb. Every 48 hours, you may take one tiny step. A step can be one of 3 things, but only one at a time. You can increase one dose by 0.025 grams, or you can add another dose to the day, starting with 0.025 grams. Or you can slide one dose 2 hours earlier, moving it slowly toward the morning. Again, choose only one of those moves every 48 hours so you can see what changed and why. Start by building your day from back to front. After the first evening dose is steady, your next new dose sits 4 hours before bedtime. If that feels okay, after 48 hours, you can add a late afternoon dose, then a mid-afternoon dose, then late morning. Your day feels from the end toward the start, like turning on lights one by one in a hallway. This keeps sleep safer while you learn. Keep a simple log. Write the time, the dose, and what you felt. Did your pain ease? Did your muscles relax? Did your stomach calm? How long did it last? Did your heart race? Did your head feel foggy? A small notebook or notes app works. Data beats guesswork. When your notes show good relief without side effects, hold there. If relief is not enough and you feel clear, then take the next step after 48 hours. There is a driving rule that must be firm. Do not drive or use heavy machines for at least 6 hours after a dose of THC. If you still feel slowed, wait longer. Your reaction time, focus, and judgment can stay off, even when you feel fine. Add more time if your dose was higher than usual, if you used other sedating meds, or if you feel sleepy. Your safety and other people's safety matter more than any schedule. Let's talk about side effects and what to do. If you feel too sleepy, dizzy, anxious, or foggy, that dose is too much for now. Step back to the last dose that felt okay and stay there for a few days. Drink water, eat simple food, try a walk. Good sleep and steady meals calm the nervous system and make dosing smoother. If your heart pounds or your thoughts race, the same rule applies. Go back one step and give your system time. Some people find that a little CBD can soften THC side effects. CBD can lower the edge of worry or fast heartbeat in some people and add its own gentle benefits for pain and sleep. But CBD can also make you sleepy, and it can interact with other medicines. If you want to try it, start very small. Use 10 milligrams CBD in the evening,
2 drops of 10% CBD oil for 2 nights. If you are not too sleepy and you want more daytime calm, add 10 milligrams in the morning. If needed and well tolerated, you can increase to 20 milligrams in the morning and 20 milligrams in the evening later on. If side effects show up, drop back to the last dose that felt fine and stay there.
Here is a clear line that keeps you safe while you learn. On the day you change your cannabis dose, and the day after, do not change the dose of any other medicine, alcohol, or drug. One change at a time lets you see what caused what. This also helps your doctor or pharmacist help you. If you take sedatives like benzodiazepines, sleep pills, or opioids, be extra careful. These can add to THC's drowsy effect. The mix can slow your breathing and your reaction time. It may also make you feel faint or muddled. Space them out under your doctor's plan and keep doses low while you learn your cannabis dose.
How fast should you increase? Your body tells you. If relief is not enough and you feel clear, increase by 0.025 grams at 1 dose, or add a new 0.025 gram dose, or move 1 dose 2 hours earlier. Then wait 48 hours. Do not do more than one of those changes at once. Keep 4 hours between doses at the start. If you reach steady relief and still feel clear, you can shorten some gaps later under your doctor's advice. The early weeks are for learning, not rushing.
Think in simple numbers. A 0.025 gram dose of 20% THC flower contains about 5 milligrams THC before any loss from the device or your breath. Many people feel relief with 5 to 10 milligrams THC per dose when inhaled. Some need less, some need more. Very strong flower has 25 to 30% THC, so your 0.025 gram pinch holds more THC. If your flower is stronger, move even slower. Your notebook will catch this for you.
What is a common daily need? Many people get good relief with well under 1 gram of high THC flower spread through the day. For most medical cases, going above 0.8 grams per day of very strong flower is rarely needed. Some people with severe, constant pain may need more, but this should be a careful plan with your clinic. If you find yourself rising dose after dose without better relief, pause. You may be chasing tolerance, not healing. Make sure sleep, movement, food, and stress care are in place. Those simple pillars amplify what cannabis can do. Let's make the vaporizer work for you. Grind your flower lightly so air can move. Pack the chamber loosely. Do not stuff it. Set the heat near the middle range. Many people like a range around 180 to 200 degrees Celsius. Lower heat means clearer and less sleepy. Higher heat can feel heavier in the body. Take slow, gentle draws. You do not need to hold your breath. A calm sip works well. Clean your device each week so resin does not block the airway, and change your dose. Here is a tiny evening plan you can use as a start. Day 1 and 2, take 0.025 grams at 8 p.m. Watch for calm, pain relief, sleep, and any side effects. Day 3 and 4. If you need more and feel clear, take 0.025 grams at 4 p.m. and 0.025 grams at 8 p.m. Day 5 and 6. If you still need more and feel clear, you may either increase the 8 p.m. dose to 0.05 grams or add a noon dose of 0.025 grams or move the 4 p.m. dose to 2 p.m. Choose only one of those and wait 48 hours. Keep going this way, 1 change, then 2 days of watch time, until your day has the relief you want without haze. What about mornings? Mornings are for later, after evenings and afternoons are steady. When you do add a morning dose, start tiny. A 0.025 gram dose after breakfast is a soft test. Ask, do I still think clearly? Can I do my tasks? If you need to drive, skip that morning dose. Safety beats speed every time. Food, drink, and life can change how cannabis feels. Coffee can lift anxiety in some people, especially with THC. Alcohol plus THC can make you very sleepy and slow. Try to avoid that mix. Stay hydrated. Eat simple, warm meals your stomach knows. If you take medicines that can make you sleepy, like benzodiazepines, opioids, some antihistamines, some muscle relaxers, space them away from THC and keep doses low until you know your response. Your pharmacist can check for interactions if you share your full list. Sleep may get strange at first. Dreams can come back vivid. Some people wake more. This is common while your brain adjusts. Keep your room dark, cool, and quiet. Put screens away an hour before bed. If you wake, do not fight it. Sit up, breathe out longer than you breathe in. Sip water. Read a few calm pages. Your sleep usually evens out as your dose stabilizes. Your body will show pattern. Some people feel best with 2 or 3 doses a day. Some prefer tiny, even doses 4 hours apart. Some use only at night. There is no one right map. The right plan is the one that gives your goal less pain, less nausea, better sleep, fewer spasms, while your mind stays clear and your life stays safe. That is why we move in tiny steps. That is why we wait 48 hours between changes. Small word about tolerance. With regular THC, your brain can adapt. You may need more to get the same effect. The way to slow this is to use the least dose that does the job and to keep your doses spaced. Some people take 1 or 2 light THC holidays a week, where they skip a daytime dose or use CBD only at night. Do not change many things at once. Keep it simple and steady. Your log will tell you if tolerance is creeping in. Here are 3 small stories to make this real. Sam has nerve pain in his leg. He starts with 0.025 grams at 8 p.m. After 2 days, he adds 0.025 grams at 4 p.m. His pain drops from an 8 to a 5 by day 6. He tries to increase the night dose to 0.05 grams and feels too sleepy the next morning. He steps back to 0.025 grams at 4 p.m. and 0.025 grams at 8 p.m. and he feels clear with pain at a 5. He holds there for a week and then adds a noon 0.025 gram dose because he still has a bad flare at lunch. It works. He keeps 4 hours between doses and does not drive until after dinner. Maya has muscle spasms and poor sleep. She starts with 0.025 grams at 9 p.m. She sleeps deeper but wakes groggy. She tries CBD 10 milligrams at 8 p.m. for 2 nights and keeps THC at 0.025 grams at 9 p.m. The grogginess eases. After 2 days, she adds CBD 10 milligrams in the morning to reduce daytime tension. It makes her a bit drowsy at noon, so she drops the morning CBD and keeps only the evening CBD. She stays with 1.025 gram THC dose at night and feels rested. Rafi has morning nausea from a long-term condition. He builds from the evening backward over 10 days. When he finally adds a 10 a.m. 0.025 gram dose, he tests that on a day with no driving or heavy tap. It helps his nausea without fog, so he keeps it. When he tries to push his 10 a.m. dose to 8 a.m., he feels jittery with coffee. He moves it back to 10 a.m. and reduces coffee. The jitters stop. Red flags mean stop your plan and get care now. Chest pain, passing out, severe vomiting, a seizure, seeing or hearing things that are not there, thoughts of hurting yourself or someone else. If these happen, seek urgent help. Your life and safety are more important than any schedule or dose. Let's talk about a ceiling. If you reach 0.8 grams per day of strong flower and still do not have good relief, pause and review the whole plan with your clinician.
Make sure you are using the vaporizer well. Make sure your sleep, movement, and stress care are in place. Think about the goals again. Sometimes the goal is pain-free. Sometimes the goal is pain-less with better function. Those are different. If you truly need more than 0.8 grams per day, you should be followed closely and consider other routes or blends. You may hear myths. Take a big dose at night and you will build tolerance faster and feel fine in the day. In truth, heavy night doses can leave you slowed the next morning. Edibles are the same as vaping. Not at all. Edibles rise slowly and last much longer. That can be useful for steady nighttime pain, but makes learning dose harder. If it is medical, I can drive sooner. No. Medical or not, THC can still impair driving. Respect the 6-hour rule at least, longer if you feel off. Here is a simple daily rhythm once you find your dose. Wake, hydrate, eat a small protein breakfast. If you use a morning dose, keep it tiny and avoid driving for at least 6 hours. Midday, walk or stretch. If you use a noon dose, keep 4 hours from your morning dose. Late afternoon, choose movement or rest based on your symptoms. Evening, keep screens down and lights low. If you use CBD, take it 1 to 2 hours before sleep. If you use THC at night, keep that dose the smallest dose that still lets you sleep. Care for your mind while you dose. Make a calming list you can do in 5 minutes. 1 song you love, a warm shower, 3 slow breaths, stepping outside and naming 5 things you see. These simple acts support the nervous system and make lower doses work better. Share your plan with one trusted person so they can help you notice patterns and handle tough days. Only change your dose if 2 things are true at the same time. Your desired effect is not there yet, and you have no side effects at your current dose. If either is not true, do not increase, wait, adjust other lifestyle supports, or step back 1 notch. Your body is not a machine. It is a garden. It needs time between waterings. It needs the right light. It will tell you when it is too much and when it is just enough. If you choose to add CBD to ease side effects, remember that it can make you sleepy and can interact with some medicines. If you use CBD oil, count drops based on the label. A common 10% CBD oil has 100 milligrams per milliliter. 2 small drops are about 10 milligrams total for mini droppers. Start low. Check in with your pharmacist if you take other medicines that affect the liver or make you sleepy. Add morning CBD only if evening CBD was fine and you are not too drowsy the next day. Finally, hold this truth. You do not need to rush. The goal is not the biggest dose. The goal is the smallest dose that meets your need and lets you live well. Small steps every 48 hours will get you there. 4 hours between early doses keeps you safe while you learn. 6 hours after a THC dose before you drive protects you and others. 1 change at a time shows you what works. And a kind voice toward yourself makes the whole path easier. Take a breath, place your hand on your chest, say, I can learn this. I can keep myself safe. If this helped, share it with someone who needs a calm plan. I'm glad you are here and taking care of yourself today. Have a nice day and see you in the next one.